You are all in for a big treat today as I am having my friend Sarah on my channel, and she is a CRNA of 10 years. She is bringing so much wisdom and insight to my channel today, and I'm so excited for you all to hear this interview. Sarah is from the Atlanta area and recently returned to this area. Like I said, she has been a CRNA for 10 years. And when she's not passing gas, this is what she said, she enjoys time with her nieces and nephews, going on tropical vacations, playing sports, listening to audiobooks, being involved with Bible studies, and dreaming about moving to Costa Rica. And before I get into this interview with Sarah, I do want to tell you about Pretty Farm Girl. Pretty Farm Girl is an organic and handmade skincare line. I am wearing all Pretty Farm Girl right now besides my mascara. And let me tell you what, this skincare and makeup line actually works to nourish your skin and heal your skin and bring it back to that good microbiome that you want. If you are interested in Pretty Farm Girl, check the link in the description of this video. And let me also just say, I forgot to plug in my mic for this video. I was so upset. This is such a great interview and it could not be duplicated. So you will notice the audio is just a little bit off in this video, and I'm sorry about that. There is so much wisdom and insight in this video regardless that I know you will find it helpful regardless of the audio quality. So with all of that being said, please enjoy today's interview with Sarah, CRNA. Well, thank you, Sarah, for being here today and being on my channel and sharing all your insight and your wisdom with my subscribers and viewers of this video, all about being and becoming a CRNA. So with that being said, let's get into the first question, and that would be, what led you to become a nurse in the first place? Not a CRNA, just a nurse.
Okay, thanks, Catherine, for having me. My mom is a pediatric nurse practitioner, and I was always so impressed that no matter where we went, she was helpful. At home, for neighbors, someone passing out in the airport. And my dad was military, so we moved around a bit, and wherever we lived, she could easily find a job. I figured nursing was a low-risk major. At least I'd learned something practical, and there would always be job security and flexibility.
Is that not the truth? My mom, I think you know this, is also a nurse, and she said the same thing when I was looking into careers in high school, what to do. She's like, well, if you become a nurse, you will always have a job. I was like, okay, I guess that's it. That's a good field to go into.
Yeah.
Okay, so then how long did you work as, just a nurse? I don't like to say just a nurse, but I'm going to put it in quotes. How long did you work without an advanced degree before you went back to school?
4 years.
Okay, so you went back relatively early.
Yeah.
Okay.
Yeah. I would say optimally, it would probably been 3 years if I could do optics.
Okay,
but yeah.
So you would have gone back sooner?
1 year sooner. I started getting comfortable, just living my life, not wanting to study anymore. I was comfortable in my job. I loved working in the ICU. I felt I was gaining competence, and life was easy. Life was good. So why stress the situation?
That's right. That's right. I have a desire to go back to school one day, not anytime soon, but I couldn't imagine being 3 years or 4 years like post. I guess I did go back to school for my bachelor's, but that was right away. But that's not an advanced degree, I would say. But I could not imagine studying for an advanced degree right now, or even at the time of 3 years or 4 years, because you're like, oh, this is nice. I'm comfortable. I know where I'm at. I feel good in my role. And then you throw schooling on top of that.
Right.
All right. And so why did you pick CRNA school?
So, well, I knew I wanted to go back to school just in general. While I was in nursing school, I realized that it didn't dive as much into pathology and pharmacology as I wanted to. I got used to in prereq courses really deep diving into subjects, going into physics to emulate chemical structures and squeezing everything out, so much out of math that you got to imaginary numbers. And I went from all of that to nursing school, which consisted of a vast dabbling in and sweeping through pathophysiology. And it felt like there was just too much to cover in 2 years to become really proficient at anything, or at least what I wanted to do. And that wasn't the point in nursing school. It functions well to equip students to notice abnormalities, but often stops short of fixing problems. There just isn't enough time to go that detailed, and I was missing the deep dive.
Yeah.
So while in nursing school, I knew I wanted to further my education. I just wasn't sure in what.
Yeah,
I thought about pharmacy.
Oh, sorry. No, go ahead. I heard recently that I was either on a podcast or a YouTube video I was watching, but people complaining like the population, and I understand this because this is a complaint of mine, of having to see like 10 different doctors for all these different issues. But of what you're saying, it makes total sense of how you saw nursing. And it's so true, is that it's just like surface level. And I'm sure that's how it is in becoming a MD or a DO. It's hitting that surface level, but you really have to get specialized if you really want to get to the root causes and the root issues of a condition.
Right.
So you were interested in that aspect of like getting deeper.
Yeah. Yes. But at the time when I first started working, I wasn't really familiar with anesthesia. So I considered pharmacy, at least I would know the drugs well. But then I don't know if you've noticed this, but pharmacies and hospitals are always located in some basement dungeon room with limited light, and lights are flickering, and even more limited people interaction. And then outside of the hospital, in the box stores, to me, it just seemed like working in like a fishbowl situation or a glass case of no emotion. So I cross pharmacy off. And then nurse practitioners and physicians in the hospital setting seemed just they always seemed overwhelmed and overworked and just kind of over it all. But medical school was still appealing to me. I just wanted at that time to prioritize raising a family potentially, and for the potential of part-time and flexible working, and the uninterrupted time and significant financial investment of medical school, residency, potential fellowship into my 30s just seemed too daunting.
Yes, absolutely. So who would you say gave you the idea of becoming a CRNA, or was it just kind of like, all right, I'm going like checking the boxes, seeing what I can do with an advanced degree?
Yeah, it was my first job in the ICU. It was during the post-op heart surgery. Patients come directly from the OR to the ICU. They skip PACU altogether.
Oh, wow.
And so the CRNA gives us report, and we take the patients from them. And so I really got to see kind of what they're doing. They come up a hot mess from PACU. They're on 2 towers of vasoactive infusions, 3 monitors with squiggly lines upon squiggly lines and numbers, and they're intubated and sedated. And it was just so fun. It was so fun to take those kind of patients, and for the first time have increased autonomy. We had standing orders, PRNs lists of drugs and blood transfusions and actions, even working with respiratory to decide when to extubate the patient, all without contacting a physician. So I really liked the added autonomy. And also just watching firsthand pharmacology meeting physiology right there. I'd read about the target receptors of these drugs they would come up on, and then dialing in or transfusing exactly what was needed for the patient, seeing the heart's preload and afterload and contractility all be affected. And it was a lot of fun.
Yeah. You and I are totally opposite when it comes to that stuff, but we're very similar in a way too, with the autonomy. When I was working in the ER, we had standing orders. I didn't have to ask a doctor for all these things. I could just like do what I wanted with my nursing orders.
But as
Yes.
soon as the patient was put on a vent, I was like, all right, let's get him up to the ICU. I'm like, I do not want to take care of him anymore.
Yeah.
Oh, that's
Yeah.
funny. That's funny.
Yeah.
Okay, so you went back to school
hmm
after 4 years, and then um, how long was school, and were you still working when you were in school?
Yeah. So, yeah, school, the decision to do anesthesia was the easy part. School, not easy. Um, just as a quick recap, to get into anesthesia school, you have to have a BSN, a bachelor's specifically in nursing with pretty good grades, and most require a GRE score, a decent GRE score, and all require at least one year of full-time ICU nursing. And a lot of schools don't count NICU nursing, or some don't count pediatric ICU. But school itself, intense, time occupying. You're working overtime. You don't have time to work at all. I'll
Okay.
add a caveat. Yeah. So, but when I was in school, it was only 2.5 years. It was 30 months through all summers. Now they've added 6 months to the program to make it streamlined into a DNP program, a DNP
Oh,
degree, and so I've heard of programs putting those classes, those extra research classes up front and primarily online, unlike most anesthesia specific classes, which would be in person. So the caveat is you could potentially work PRN or continue to work during that portion, whenever that portion is in the program you choose. That would be the only time you could work. I personally did keep my job PRN, and they allowed me to work. We had like a couple weeks off for Christmas. Most schools don't. And so I went back and worked in the ICU then, and it honestly wasn't really worth it. I was like, I should have taken the break and got some, rest, but it was financially helpful.
yeah. I feel like, or I shouldn't say I feel like, I did not know that going back to CRNA school, you shouldn't work because I have worked with so many nurses going back to school to become a nurse practitioner, but they are
Right.
working, like they're still working full time or part time. But I did not realize that for CRNA.
Yeah, it mirrors the medical side of the profession a lot more. It's just fully intense. And I mean, every minute you're either in class or in clinical, and you go home and you're studying no matter what. So
Okay,
it's a lot.
kind of like nursing school, but I would imagine, like you said, it's a lot more detailed and you have to know all those details, of course.
Yeah.
Okay.
Yeah.
Okay, so your program you said was 30, did you say 30 months?
30
30
months.
months
Yeah.
long.
Or 31. Yeah.
Okay. Okay. And then did you did you have family help support you in that time? Did you prepare financially before you went into school or how did you make that work?
Yeah. So I worked, so the 4 years I worked, now granted, this was, 15 years ago almost. So I was making about $22 an hour. Like
Yes.
not,
Yes.
I had a night shift. I had a night shift differential. It was hard to save up a lot of money on that, but I was able to save up some money. I paid off any kind of debt that I had before going to school. So I started kind of at zero with like a little bit saved up. I always had roommates, try to split as much as I could. During clinicals rotations, I did stay with my family and friends part of the time, traveling around. We sometimes stayed in the hospital, which I really enjoyed because that was free.
Huh.
And yeah, so because we have to cover call and trauma and that kind of stuff while you're in school, and that's another reason why it'd be really hard to have a job. You're working all the time with school, but um, I yeah, so I took out student loans for every dime of my tuition,
Okay.
and I used the money I had saved for my living
Okay.
expenses.
Okay.
So yeah, at that time for 2.5 years, tuition alone at a public university, it was close to six figures of debt that I went
Okay.
into. Now that it's 6 months longer, and depending on where you decide it can get very
Yeah,
expensive.
yeah, absolutely. Yeah. I feel like that is one thing. I don't know if it's like our generation, maybe because student loans is like was a big thing for our generation. I'm going to say we're the same
Yeah.
generation because we're around the same age. I'm going to say we're around the same age.
Around this age.
You've just been a nurse a little bit longer than me.
I know.
But I feel like people don't look at the financial aspect before going into school and seeing if it's
Yeah.
going to be worth it. So would you say
Yeah.
going to become a CRNA was worth it with how much money you make now?
Oh, absolutely. And that's something you should calculate. Anybody should calculate before going into the field. I love my social workers, friends, and family, but they've made that a master's degree now. That's a lot of extra school. You got to calculate, okay, I'm spending, 100 grand on school, 50 grand, whatever it is. I'm making, half that. How long is it going to take?
Yeah.
And with CRNA, it's definitely worth it. I actually did the math before going back to school to see how long would I have to work to pay off all my school and to have more money than I would as a nurse, or be even as a nurse if I just kept working as a nurse. And at that time, it was around 5 to 6 years.
Okay.
So 5 years, 5 years after school, I would be ahead of where I was if I stayed those years as a nurse. And then it just kind of goes up exponentially after that.
Okay.
So,
Okay. What,
not exponentially.
I don't want to get into salary quite yet. Okay. So we talked a little bit about what your schooling looked like, residency, or would you call it a residency or just clinicals?
It's interchangeable. Okay. They call it both.
Okay.
Yeah.
Okay. So you went through all of that. You graduated. So what was your first job coming out of CRNA school? And I know we talked about what you made as a new grad, that $22 an hour. I feel you on that. I was at $26.10 an hour when I first became a nurse. What was the difference between being a new grad with your just RN versus your CRNA first job, and what was that first job?
Well, night and day difference. I would say, and I think most nurses, maybe you can attest to this, would say that nursing, you learn a lot in school. You're overwhelmed with how much information there is. But when you start work, you lean heavily on OJT, on job training. And that's where you get the majority of your skills. And it's complete opposite in anesthesia school. You are so well prepared. When you finish, you can be an independent provider anywhere you go when you walk through the doors. The school is so intense, and you have so many clinical rotations, and anesthesia is very similar in a lot of degrees everywhere you go. Night and day different.
That's really hard to imagine, because you're right. When you first come out of nursing school, you feel like you're like, I say this all the time. I felt like I was gonna like kill my patients. I'm like, what am I doing? Like, I am
right.
What is happening? And even on clinical, it's like you see that stuff on clinical. And where I went to school, we had a lot more clinical than the typical like 4-year college, because I was at a diploma school and it was a hospital school. So we had tons of clinical, but I was still like, man, this is all on the job training. So CRNA school was opposite, which is so hard to think about.
Yeah. It was good. So I think you asked me, my first job was it was at a trauma center, level 1 trauma center in near the Blue Ridge Mountains. It was level 1 for adults and level 2 for pediatrics. Okay. So it was, I say you're, I don't know what word I chose, but competent, comfortable to do all things, but you're still learning like crazy. Yes. You're not, they say after about 5 years, almost everyone I talk to, and in my own experience, about 5 years of working full time as a CRNA, then your heart rate doesn't really go up as much as it used to, and you're able to like just be on call, walk in, take whatever comes at you with relative ease.
Okay.
But that's about 5 years.
Okay.
So
until the nerves start fading and drifting off a little bit.
Right. Yeah. I don't think they fade ever if you're doing pediatrics, which is why I don't prefer to do pediatrics. It's just too much at stake, I feel like. But my first job, I wanted to do peds and sick OB and hearts and cranies and gunshots, and I got all of that. The only thing my hospital did not do a lot of was transplants. And so I'm not a bucket list person, but if I were, I would want to do transplants eventually. But
yeah, those are some long surgeries right there.
Yeah.
Okay, so that was your first job. Where are you at now?
So during COVID, like most people probably experienced, every facet of my life was changing. So I decided to move closer to family and a healthy church here in Atlanta. And honestly, as a CRNA with so much flexibility, finding a job was more of an afterthought to me. I know not for everybody, but I knew I could and still can change it up. And with my loans paid off, I was a free agent and I was ready to prioritize my personal life. So for me, that meant banker hours. So the 5 main job preferences I was looking for at my current job: 1, no mandatory nights, weekends, or holidays. No mandatory call, but still somewhat acute, interesting surgeries, which is hard to find with no call. But I didn't want to do OB. I wanted to buy a house immediately, so I needed it to be a W-2 position. A lot of CRNA jobs are 1099.
Really?
Oh, yeah. And that's where you can really get more flexibility and even higher income than potential.
With the 1099.
Yep. You pick your schedule, you work, you can dabble in different places, dental offices, aesthetic centers, all kinds of places and things. Oh, and hospitals. The trauma center that closed here in Atlanta had a lot of 1099 options for CRNAs.
I would have never imagined that a hospital, I'm going to say employee, but not really, what is 1099 versus W-2?
Yeah.
Huh.
Yeah, anesthesia is often sometimes you are hospital employees, but more often I think they contract with private groups. And there's physician-owned ones, there's CRNA-owned ones, there's just all kinds of, there's just agencies that help supplement. And
is it kind of like travel nursing? Like you have that agency and then the hospital finds their employees through that agency?
Not completely. Okay. Like I don't think a hospital would do fully through an agency. But it's more supplemental to whatever situation they have worked out.
Okay. Oh, man. Huh.
Yeah.
I'm so glad you said that. And this is why I'm excited that you're on my channel, because this is stuff that I feel like is just not common knowledge, or when you're researching to become a CRNA, this is something that I don't know if this would even pop up in an article or a blog post.
Yeah. Yeah, there's a lot that you learn, and there's so many resources out there, especially now that, I don't know if you've heard that anesthesia is the best kept secret in healthcare or whatnot. Like now that's not, and there's so many resources out there. There's classes you can take to learn more about doing 1099, starting your own business. I mean, the sky is the limit for opportunities doing this.
That is such the beauty of nursing. And I said that to everyone I talk to, because we all, and everyone I interview, it's not doing what I am doing or what others have done that I've interviewed. There are so many opportunities in nursing, and it's wonderful. I absolutely love that. And like you said, like our moms who are nurses, both doing totally different things than what we are doing.
Right.
Mm-hmm. They're the old school nurses, we'll say.
Oh, yeah.
Yes, that's right. All right. For my last question, I didn't tell you I was going to ask this question. What is your most memorable surgery?
Oh dear. Oh, the smells. They're just hitting me. So in a lot of ways, it's really the neck fash stuff. They're very okay. I know. Oh gosh, I could cry thinking about it. There was a young woman in a car accident who, the car completely totaled. She was pregnant. Like, I want to say it was around 32 weeks, maybe less actually. 30 weeks pregnant. She was in a brace, and it was one of those all hands on deck. She's bleeding internally. They got to get the baby out, but she's aware, but they don't want to. We don't want to over medicate her because then everything goes to the baby, or most things. Anyway, she comes in and she goes, "I don't care what you have to do. You don't have to give me anesthesia. Just save my baby, save my baby." And it was so heart wrenching. We get her to sleep safely. The whole room is just like, there's silence. And ORs are usually playing live music. You're talking, how's your weekend? Like, it was not, it was like a pin could drop. We were just, everyone was doing their job focused, not, and about, gosh, it wasn't 10 minutes into the surgery, they get the baby out, and the NICU's there ready with their little incubator, and you hear the baby cry, and like not a dry eye in the room. It was super sweet. Mom ended up waking up fine. Baby did fine. It was really incredible.
Oh my goodness.
So,
Oh, that like makes me want to tear up just thinking through that and just going through labor myself. Like, I could not imagine. Well, and even just like being in the ER and like being in those high risk situations. And I know the exact feeling that you're talking about of everyone is just quiet and everyone is, you're nervous, but you can't say anything because you don't want to make the patient feel uncomfortable or, yeah. Oh man, that is so hard, but praise the Lord that both baby and mom were okay.
Yeah.
Oh,
amazing.
Okay.
Yeah.
One more. Before my last question, what was your longest surgery?
Longest surgery. So, actually, my mom, I didn't know I was going to be covering this facility where I'm at now, but my mom had surgery there 10 years before I was working there. So while I was in anesthesia school, actually, she had surgery, one of the places I worked, and her surgery was 2 days. So they did take a break. So it was like a 12 to 14 hour surgery the first day. Everyone went, they did wake her up. They extubated her. And then the next day she had to go back to finish. It was a huge scoliosis reconstruction back surgery. And then they had to do both sides. It was crazy. And so I work there now and I do surgeries there like that. I don't know if I've done one as long as my mom's surgery was. I've only been there a little less than 2 years. So, but yeah, I would say easy 12 hours, but outlasting my shift. So I work 10-hour shifts, where I work. I do 4 10s during the week. And so, there's longer shifts that will take over from me. So
that's insane. Okay.
Yeah.
What do you do if you have to pee?
Yeah. So I remember before anesthesia school, one thing I noticed about most of the CRNAs I met, I'm like, oh, they're all kind of like relaxed and kind of comfortable, and they all seemed fit. And I was like, I wonder if that's a good sign of work-life balance. But what I've realized is I think it's because you can't eat in the operating room and you can't get a break when you want to. So like you're kind of just, so you can't leave the patient. So you have to wait until somebody is free to come and get you out.
Do you ever wear depends?
No. But, if I had IBS or something, it might be something I would consider. And that's one thing to look into when looking for a job. You want to make sure you're working in an environment that has extra staff or anesthesia people available. So whether it be an anesthesiologist, another CRNA, somebody that is free to be able to help in an emergency, and also, not more importantly, but almost equally important, to let you out. And so there's kind of everyone gets a break, ideally around 9 a.m., 15 minutes, door to door. Get a snack, go to the bathroom, come back. And then you get a lunch break, 30 minutes door to door. And then if you're still there in the afternoon at some point, someone will try to get you out for another 15-minute break.
Okay, so it is all hands on deck. You are constantly in the zone, all shift.
Yeah. All shift. Now you do, if you're in one long case, you're stuck in there. Now, most of the time in my 10 hours, I do about 3 surgeries, sometimes 4. If I'm doing endoscopy at a GI clinic, I'm doing 15 different things. So I can run, grab a quick bite to eat, a quick break in between the operating room getting set up. You're kind of usually assigned to one operating room. You stay in there all day with the same surgeons usually, but you're in that room, you set it up, and then when you're done, you go and maybe relieve somebody else in a different room. But generally, so there's usually chance to do a quick break, but you just don't want to hold everybody up on eating bonbons.
Yes, that's right. Okay, my final question for you, Sarah. What advice would you give to those looking into becoming a CRNA?
I would say, well, time flies. Start saving now. Start healthy stress management now. If you're newly married or potentially so, I've heard it's helpful to be married at least a year before starting. If you're in the ICU already, go ahead and take the GRE and the CCRN, the Certified Critical Care RN exam. It preps you well for interviews. And if you end up staying in the ICU, getting your CCRN is just a good knowledge base booster. It's helpful. It's probably the only helpful test I took before school. And then basically just do it. It's not for everyone, but it's almost for everyone. You could edit this part out, but as a quick aside, I feel like I should mention that I would discourage from anesthesia anyone with a history of substance, especially narcotic abuse. We handle copious amounts of controlled substances with limited accountability. I've heard the narcotic diversion rate for anesthesia providers is shockingly high, between 10 to 20%. That's a handful from every class at every hospital.
Wow.
And I personally know multiple friends, students, classmates, preceptors. I've seen personally that so many wreak havoc in their lives due to the temptation, literally in our fingertips. And is not something any of us are above, and the threat to oneself and others is not to be taken lightly.
Yeah.
So
I'm not editing that out. I think that's an important point to put it. I think that's very important to put in. Yes.
Yeah. And it's something, you're always aware. There's not an MO really for someone who would divert. So you just always got to be thinking what's best for your patient and protecting them as much as possible when you do get breaks and that kind of stuff.
Yeah, absolutely.
But what kind of patient or person, is anesthesia for? So I've thought of a list of character traits that I think would be helpful. If you can mark the checkbox for all these, I would highly recommend CRNA. If you have a curious nature and desire independent decision making, if you handle stressful situations well, they say that anesthesia is 95% boredom and 5% sheer terror. There's a great meme that shows an anesthesia activity chart, and it has a symbol of someone sitting, and it says all is good. And then it has a symbol of someone standing, and it says someone is dying. It's always it tracks, and it always makes surgeons nervous when I stand up and look over the drapes. They always everything okay?
Yes.
You need to be able to do basic math quickly and under pressure. You'll be mixing all of your own drugs with concentrations that a mistake could be deadly. There will be nobody standing behind you fact checking your dosing. You had to be competent and confident in drug calculations with high stakes. I laugh thinking about all the calculus and algebra I've taken when literally just having a 4th grade math with somebody yelling at you would have prepared me better. You can be a type B person. Most are type A. But you can be a type B, but you have to have attention to detail. You'll be tediously rechecking these tiny little drug labels and labs, and you have to be able to quickly think through emergency algorithms. And all of a sudden, you can be sitting there daydreaming. I daydream about RVs lately, and then suddenly you're going to have to like snap through emergency pathways if something happens during surgery or to your patient. You should be a humble person that admits when, not if, a mistake has been made and remains correctable, teachable, approachable. I knew a CRNA, or I knew of a patient who coded because the CRNA was too prideful to listen to the OR nurse's concern that the patient's breathing pattern had changed. They were about to roll out of the operating room. She was charting, and the nurse said something, and she blew her off and said, "No, the patient's breathing, they're fine." And that pride, I don't know how the patient did after that, but there was a code, not good. So humility is huge, but you also have to have confidence and care enough to be able to stand up to surgeons, administrators, nurses, anyone to advocate and prioritize the patient. Refuse to continue if it's safest for the patient. And most often you have 2 minutes of interaction with a person to establish trust. You are their greatest advocate in surgery. They will be completely helpless in your hands. And you should be a person who takes that seriously, who stays up to date with research, who treats everyone, heroin addicts, inmates, perpetrators, grumps, the haves, the have-nots, everyone as if they were your mom, and always do what is safe and right for the patient, despite difficulties, reputation, pushback. And I mean, overall, I would say to come alongside a person in such a vulnerable state to help them feel secure and try to give them the best care possible. It's sincerely an honor to do this job, and I'm just grateful every day that I get paid to do something so fun.
Oh, that just puts it all into perspective and like makes me love nursing that much more. How you articulated all of that is that what you said, you have 2 minutes to establish that relationship, and their life is literally in your hands, and not being prideful in that, not if, but what you said, when you make a mistake, and listening to your teammate. That is, I think that's humbling to hear, and I think that's a good reminder for every single nurse to hear.
Yeah, for sure.
Well, thank you, Sarah. This was a wonderful conversation. I think this will be very helpful to my viewers and subscribers who are looking into becoming a CRNA. And even if they're not looking into becoming a CRNA, I still really enjoyed this conversation and learned a ton about being a CRNA and becoming a CRNA. So thank you so much for coming on my channel today.
You're so welcome. Thanks, Catherine. Enjoyed it.
All right. Thank you, Sarah. I'll talk to you later.
Okay.
Bye.